Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why do babies and children get black tongues? If your child has a black tongue, you might be worried that something is really wrong. While it can be frightening, it's usually harmless and easy to explain. Still, you should know certain warning signs to look for. /r/n/r/n This article will go over what can cause black tongue in children, when you should get medical care for it, and how to get rid of it if it doesn't go away on its own. /r/n/r/n Some causes of a black tongue in children are medical, while others aren't. Non-medical causes include /r/n/r/n Among medical causes, they can either be related to illnesses or medications. Some illnesses that can cause a black tongue are /r/n/r/n Some children are born with a black tongue. It's considered a birthmark and is called pigmented nevus./r/n/r/n The most common cause of a black tongue in kids is the popular over-the-counter, OTC, medication PeptoBismol. This drug is used to treat /r/n/r/n PeptoBismol contains an ingredient called Bismuth subsalicylate. When bismuth mixes with sulfur, a natural component of saliva, it forms bismuth sulfide. This substance can make your tongue look black. /r/n/r/n This discoloration typically goes away on its own a few days after you stop taking the medication. /r/n/r/n Kids under 12 shouldn't take PeptoBismol or other drugs containing bismuth subsalicylate. The ingredient has been linked to a condition called Reyes syndrome in kids. /r/n/r/n Reyes syndrome is a serious and potentially fatal illness. It causes /r/n/r/n Symptoms include /r/n/r/n This illness usually comes on soon after a viral illness. If you see these symptoms in your child when they're recovering from something, get medical treatment right away. /r/n/r/n These medications also can cause Reyes syndrome. Ask your healthcare provider before giving them to a child. /r/n/r/n Due to the risk of Reyes syndrome, regular PeptoBismol isn't approved or recommended for kids under 12. Alternate medications are used for treating digestive problems and H. pylori infections in children. /r/n/r/n Children's PeptoBismol doesn't contain bismuth subsalicylate and is considered safe for kids as young as 2. If your baby or toddler has diarrhea or digestive issues, ask your pediatrician how best to treat it. /r/n/r/n With its distinctive pink color and minty flavor, some children decide to drink PeptoBismol. If your child has a black tongue and you don't know why, it may be wise to ask them if they've drunk PeptoBismol or check to see if some is missing from the bottle. /r/n/r/n Also, watch for dark stool, poop. Bismuth causes that when it mixes with sulfur in the intestines. /r/n/r/n Be sure to keep PeptoBismol and all other medicines where children can't get to them. /r/n/r/n In adults, causes of a black tongue include smoking, cancer, side effects of chemotherapy, or bleeding. These causes are rare in children. /r/n/r/n Usually, most causes of black tongue are harmless, and the only concern is how it looks. However, watch for warning signs of a medical condition, including /r/n/r/n Get urgent medical care if your child has a black tongue. Plus, /r/n/r/n Call your healthcare provider if you notice any of these symptoms along with a black tongue. /r/n/r/n A black tongue from food usually clears up quickly on its own. If it's caused by medication, it should go away soon after the child stops taking it. If not, their dentist can gently scrape the tongue to get rid of the color. /r/n/r/n If the black tongue is caused by an illness, it may last until the condition is properly treated. This may involve prescription antifungals or antibiotics. /r/n/r/na black tongue is usually harmless. If your child eats or drinks something with a dark color, such as candy or berries, it might make their tongue black for a short time. /r/n/r/n some infections can also cause a black tongue. So can PeptoBismol or other medications containing salicylates. Regular Pepto shouldn't be taken by kids under 12. The children's formulation of PeptoBismol is safe for children over 2. /r/n/r/na black tongue caused by food/drink should go away quickly. If it's caused by medicine, it should clear up within days of when they stop taking it. If not, their dentist can gently scrape it away. /r/n/r/na black tongue caused by an infection may require antibiotics or antifungal medications. /r/n/r/n yes. The PeptoBismol that's made for adults can turn your tongue black. /r/n/r/n The children's version of Pepto should not turn your tongue black because it does not contain bismuth, the ingredient that causes the discoloration. /r/n/r/n If your child's black tongue is caused by medication, ask their healthcare provider if they can switch to a different medication. Sometimes, a gentle scraping at the dentist's office can remove the color. /r/n/r/n If it is caused by an infection, the black tongue should go away once it's treated with antibiotics or antifungals. /r/n/r/n That depends on what is causing it. If it's from a medication, the color should go away within days of when they stop taking it. /r/n/r/na black tongue caused by infection should get better quickly once your child gets on the right treatment. /r/n/r/na severe niacin, vitamin B3, deficiency can cause a condition often referred to as black tongue, also called pellagra. It's uncommon due to the modern diet's niacin content. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.